Back on MorningLine. Thanks for joining us. Shannon Jones with us from SHIP, State Health Insurance Information Program. And she was telling me about the things Medicare will not pay for, much less Medicaid. I can't get a chemical peel.
No chemical peel.
I cannot get...
well, unless it's related to a condition that you can wrap it around.
Maybe, yeah. But what we're saying is cosmetic type surgeries, things like that, obviously. The same things that most of your conventional insurances now that you have, if you're not on Medicare, don't pay for. But mental health, it does. Depression, things like that as well, if you're bipolar and along those lines. Yes. Let's take a call from Joe. Joe, good morning.
Good morning, Nick.
Hey, Joe.
I just want to say I appreciate this lady coming on and giving us all this good information. And I have a comment and a question.
Sure.
Comment is the reason these drug companies, these insurance companies, pardon me, are dropping drug coverage is because these drug companies are absolutely robbing people in the United States. Going back, just look at the EpiPen.
Yeah, that's
what we just had. But anyway, my question is, could you briefly touch on home health care through Medicare? What services would you get for that?
Oh, that's great, Joe. I didn't even think of that. Now, does it provide some coverage then for nursing homes or in-home health care?
Well, it'd be home health. So
it would be home health, not nursing home care.
Right, right. So with home health, it would need to be a condition where you can't get to outpatient services.
Well, quiet. I don't know. I mean, I know you're not a doctor, but what kind of thing? Maybe like someone coming into, well, you could get that you can't get to outpatient, or that you're not able to get to outpatient.
So how Medicare clarifies home health benefit being approved is that you cannot, you're basically homebound for whatever the condition is. They do allow you to go to church, go to the beauty shop, but it's very limited. If you can do more than that, then Medicare discourages home health, and you may have some issues getting the home health covered, and you would be required to go to outpatient services.
Home health means that you have a doctor's visit or a nurse visit or something like that. They come to you because you can't go to them.
Right. So let's say you fall and break your hip.
Yeah, okay.
And you had surgery, so you've gone to the hospital. Then you go to a skilled facility, and you're good enough to leave the facility, but you still need some therapy at home, and it's going to be very difficult for you to go 3 times a week to a therapy group.
Right.
So home health will come in, a therapist will come in, give you the therapy, and if you need any equipment with your recovery and your condition, then there's a 20% copay on that equipment. But otherwise, home health services should be covered at 100%.
Okay. That's kind of neat. I don't know. I wish Joe was still on the phone. I was going to ask him a little bit about his Medicare coverage now. He handles it. I was trying to think of some of the other things that are or are not covered by Medicare. What about like things like chiropractic?
Some of that is covered. Acupuncture is not covered.
Okay. And the types of doctors, psychiatrists?
Yes.
Not necessarily psychologists.
There can be some with depression, with alcohol abuse or misuse. Then Medicare would cover that under a psychology visit.
Okay.
But you always, it's a good point though, you do want to check before you go outside of just a regular doctor to make sure that, number one, that provider accepts Medicare, and number two, that the services they're going to be providing are actually Medicare covered services.
Yeah. Okay. All right. I was wondering on that. And as far as the other, the doctors, it's general practitioners and all of that.
Right.
And you want to try to keep, I guess, most of them, would you say, well, most people want to keep the doctor they've had for years. Would you agree? Okay, especially seniors, maybe they've had them for years, and they're uncomfortable leaving to go to someone else. What would you say with the calls that you get into your office are the most common, perhaps, mistakes that maybe people make just because maybe they're not schooled enough on? But what are the most common mistakes people need to be aware of when they are dealing with Medicare? Missing the deadline, I suppose, would be one. If you're not in a plan that's suited to you and you don't get this taken care of during this window right now, that would be a mistake, because after December 7th, you're stuck with the one you've had. You can't. Is there any retroactive way, if you missed the 7th deadline?
There are some special enrollment periods. For example, if you live in Nashville now and you are in a plan you don't like, you could move to Memphis and have a special enrollment period. I don't recommend you doing that.
By moving triggers
Moving triggers a special enrollment period.
Okay.
But the biggest mistake is not enrolling in the parts of Medicare when you're first eligible and you have a penalty. The second that I hear most often is, my neighbor is in X plan and pays nothing. Why can't I have that plan and pay nothing? And it's just like we've been talking about. If you are taking the exact same medications that your neighbor takes,
right, so that's where it comes
and
in.
you go to the exact same doctors, then you absolutely can have that same savings that they are saying that they have.
Right.
But 9 times out of 10, that's not the case.
Right. Everyone is different. I've heard that before, as a matter of fact. So when you see it, you go, "Well, they're getting a great deal. How come?" It's case specific.
Right.
You know, if you're taking different drugs or something along those lines, that's what it comes down to.
Yes.
All right. So I'm trying to think of some of the other things just to address in terms of mistakes people make. You don't miss the deadline. Make sure you get in within the window, and then try to get it as clearly matched as you can. Is there any fraud going on?
As a matter of fact, there is.
And how does that manifest itself? I'm trying to think. Collecting Medicare benefits when you don't qualify, or what's the fraud?
Now, Medicare beneficiaries committing fraud or the providers?
Oh.
We've got both.
Both. Okay.
If a Medicare beneficiary wants to make sure that your provider is doing things correctly, it's important that you read your Medicare summary notices. Those in employer world, that's called the explanation of benefit.
Right.
But once you get into Medicare, that statement is the Medicare summary notice. And I think one of the callers was talking about, he went through and saw what was being charged by which provider for which service. And when you look at that Medicare summary notice, it tells you what the provider billed, what Medicare is going to cover, then what is the responsibility of the patient.
Yeah.
And so that's very important. Sometimes we get calls that someone has read their Medicare summary notice and they did not see Dr. Jones.
Yeah.
And it ends up that it was a radiologist that looked at their x-ray, and of course they did never really see the person.
Right.
You know.
That's why it's so hard to catch, though. You know, I mean, you and I go shopping at the grocery store, and I know if I'm getting rooked because I buy a chicken breast and somehow they charged me $15 for that, all right?
Yes.
I'll catch that. I go, $15 for chicken breast, that's wrong, because I'm schooled in that. I'll look at my insurance bill, and you can do that with your private insurer as well now, and I don't know if what they've broken down is accurate or if the charge is legitimate or not. It's impossible.
Yeah.
I'm sorry. It's just maybe after a while you get used to it and you learn how much meds cost and what they should be, and maybe some of these people have, but that's just hard.
Yeah.
I would easily be taken.
No, you wouldn't.
I think I would. Let's go to Sherry. Hi, Sherry.
Hi.
Hey, how can we help you?
Well, I've always been on just the original Medicare, and I don't know I didn't know who to talk to find out which plan is better for me. Now, my brother and his wife is on Health Springs, and they pay very little for their meds, and I don't have a med plan, and I don't know which way to go. I don't know whether to go on Health Spring and find some med plan. I'm sort of homebound right now, so it's.
That's it. Well, Sherry, you called the right place. You are exactly why SHIP exists. So, stick around. You need to get a pen and paper here in a moment, because at the end of the show, I'm going to put up the phone number for SHIP that you can call. Now, if she can call, if she knows what she needs and what her plan is, she'll be able to talk with one of the folks with SHIP, and you guys can say, okay, let's take a look what's out here that might match closer to you, right?
Right.
Now, she just addressed kind of what you said about her family has this great plan. Now, just because they're getting that doesn't mean you get the same deal simply because you have different needs. But what do you suggest for her?
Definitely call us, because you mentioned that you didn't have drug coverage now. So that concerns me, that if she has been in Medicare without drug coverage, or for whatever reason, maybe she enrolled in a drug plan and maybe got dropped for some reason, then we can look at that and see, because it sounds like there is a possibility that she could have a Part D penalty for not having drug coverage when she should. So we'll definitely look at that. And we'll also look at what prescriptions she's taking. And the tool that we use is Medicare.gov, the official website of Medicare, and it's the Plan Finder tool. And we can get on the computer at our place.
She probably won't have one. So.
But we can run a plan comparison for her based on her information. We can mail it to her, let her look at it. She can call us back. We can go through that comparison.
And help her sign up for it.
Yes, and then once she makes that decision, because we don't make the decision for you guys, you make that decision. We guide you on looking at things at low cost premiums, but you have to ultimately make that decision. And once you make that decision, we are more than happy to help you enroll in the plan that you've chosen.
That's great. So Sherry, definitely call. They're going to help you on this. I would say, I'm just guessing, and I'm just pulling this out of thin air, but I would bet at least 50 to 75% of the people on Medicare right now, maybe that's a little high, could possibly find themselves a better plan. Meaning that they're in one that's maybe working and they're loath to change because it's getting the job done. But what I mean is, if they looked at least, and they don't have to switch, but they can look. If they looked at least, they might find a plan that suits their needs a bit better and save them some money just by checking. I can tell you this, when I get to the point when I'm on it, every darn year, no matter how happy I am with my plan, I'm going to go in there and punch it in just for the heck of it and see, with my needs, is there anything cheaper?
Yes.
And if there is, I'm going to take it. Do you think that's a high number? I'm guessing 50%. If they went through it and checked and really matched it up, might be able to find something comparable for less money.
Yes.
And when you think about that, how much, is that important to you, saving a little bit of money along those ways?
Right.
Let's put up the phone number real quick, if we can. Now, this phone number that you gave me is toll-free, 1-877. Is that going to be the office here in Nashville? You guys answer? Where are you guys located?
Actually, we have the 9 area agencies on aging and disability contract to have our SHIP staff located across the state. So your number will be routed. We have a very small call center that takes the initial number. And then if you need more detailed assistance, which is typically during open enrollment, then you will be transferred to the SHIP coordinator that is closest to you. So if you're in Bristol, you'll be transferred to our Johnson City office. If you're in Cleveland, you'll be transferred to our Chattanooga office. You'll have somebody close by.
Shen, thank you so much for coming on. That's great. And I hope that woman calls and gets through, because you will be able to help her. You're great.
Oh, thank you.
Thank you for coming on. I appreciate all you do. Take a break. Programming note about tomorrow right after this.